Hello and welcome to the Fact Factory podcast, where we dive deep into the truth and trend shaping our world today. I'm your host, Ishmael Jimasa. Today we are joined by Janet Katonda, a public relations officer for Malawi Blood Transfusion Service. Janet will share insights into MBT's life-saving work and the importance of blood donation here in Malawi.
My name is Mrs. Janet Katonda. I'm the Marketing and Public Relations Manager working with Malawi Blood Transfusion Service.
What's the mission and vision of Malawi Blood Transfusion Service?
Okay, so to begin with, Malawi Blood Transfusion Service was a subsidiary of the Ministry of Health, and it was established by the Ministry of Health in the year 2003, and we started its operations in 2004. So the vision of the organization is to meet Malawi's blood needs by providing safe and accessible blood and blood products to the whole nation. And also the mission for the organization is that MBTS is committed to providing safe and adequate supply of blood and blood products for all patients in need in all authorized hospitals in Malawi by collecting, processing and also testing all blood from voluntary and remunerated blood donors from low-risk population to international standards in a cost-efficient manner.
What are the eligibility criteria for blood donation?
First and foremost is that someone has to come voluntarily, so there's no one who is actually coerced to come and donate. So every donor that comes to Malawi Blood Transfusion to donate comes voluntarily, and that person has to be aged between 16 to 65 years of age and weighs at least 45 kgs and above. And also that person is not at any cost suffering from any kind of disease or on any medication. And also we also discourage the people who are coming to donate blood. We also don't collect blood from people who practice risky behaviors like going around, sleeping around with multiple partners. So those people are considered as people who engage in risky behavior, so they are not allowed to at least donate blood.
Can you walk us through the blood donation process?
Okay, so in the process of donating blood, a blood donor comes in. So the first thing is that they actually register. So there's a form that is given to a blood donor who is supposed to register their name, gender, and other history of any type of sickness. So the form has a set of questions that the donor has to answer. So it's like, this is like the first assessment. So when they fill out the form, they go through counseling where they are at least counseled, and also we also conduct tests like a hemoglobin test where we want to see if at least the donor has an adequate HB. So every person who has an HB of 12.5 upwards, that person we can collect blood from them. But any person from 12.4 below, we don't collect blood because we consider that they do not have enough blood to be collected. So they go through that check, and then they also go through physical checks. So we actually weigh the donor. We actually want to see if they weigh at least 45 kgs and above. That person proceeds for the donation. And after that, yes, they go through, after the physical checks, they go through counseling, where the counsel, they are told of how the donation process will be, like also even chat with them and see how maybe their life has been. We have well-trained counselors who conduct that. And after the counseling session, when a person has passed through that, now they go through the phlebotomy, where now blood is collected. So blood is collected within at least a minimum of at least 15 minutes. Yeah. Yes. So that's how that's the process of blood donation.
How frequently can an individual donate blood?
Every male is supposed to donate at least every 3 months. That means they can donate at least 4 times a year. Like every female is supposed to donate at least every 4 months, which is 3 times a year.
What blood type does MBTS typically collect?
Okay, so basically we do collect all types of blood. There's O, A plus, A minus, B plus. So all those blood groups we do actually collect from them, and we as we're collecting from the donors, we actually collect like the whole blood. So we call it the whole blood, and the blood that is collected from people that maybe have donated more than 2 times. That blood is sometimes used to make components like platelets, also platelets, precipitate, and also fresh frozen plasma, and also pediatric pads. So the blood from repeat donors is used to make those kind of products.
So what tests are performed on donated blood before transfusion?
The tests that are performed, the main ones are actually HIV, hepatitis B and C. So also test syphilis. So there are 4 main diseases. So these are transmissible, transfusible infections. So we actually test for those because these are actually transmitted through blood. So our main mandate is that we at least process the blood and also make sure that the blood that is transfused to the patients is actually safe. So we actually test for those, and we have very, very reliable machines, and these machines actually detect even when sometimes even when the disease, when the TTI is actually, or the virus is actually on maybe a window period.
What measures ensure collected blood is free from contamination and free from diseases?
Okay, so it's when the blood goes into the laboratory, it's not just tested once, but it goes through the testing process the first time, and when the results are out, it is retested just to make sure that we have not actually passed the blood that is infected. So it is actually tested several times, and when we found out that another maybe when we have seen that maybe the blood has been found maybe with an infection, that blood is tested maybe at least even 3 times just to make sure that we confirm that it is really not good for it to proceed to patients.
How does MBTS transport and store blood?
We have a laboratory. We have now we have 4 laboratories in all our centers where we collect blood from blood donors, and the blood is stored there. The blood is stored. We have cold rooms. We have refrigerators where we keep this blood, the blood. But we also have distribution centers in different in different district hospitals, where also when blood is tested, it is distributed to the district hospital so that people surrounding that district hospitals, hospitals surrounding that particular district hospital can go and collect from the district hospital.
Many people say that the Malawi Blood Transfusion sells blood. What's your remarks on that?
Those are just myths that are there. Apparently, Malawi Blood Transfusion Service does not sell blood. So what happens is that when we collect blood freely from blood donors, and the blood is actually processed here at the Malawi Blood Transfusion Service. And you agree with me that from collecting to processing, there are several things that and several costs that are incurred. The testing items, the bags that we're using for collection, and all those. So what happens is that the Malawi Blood Transfusion, when they collect that, they distribute to the hospitals. So when the hospitals are coming in to actually get blood from here, they actually pay for, they actually give, what do you call this? The service fee, like the service fee that that has been incurred on the blood. So for the government hospitals, it is the government that pays for that particular fee. So it's not a person who is supposed to pay for that fee. So when someone goes to the district hospital, let's say, or a government hospital, a person is supposed to pay for any amount of money because the blood there is actually for free. They're not supposed to pay for that. And when also people go to the private hospitals, they're also not supposed to pay for that. The only thing that they pay at the, let's say, private hospital is the service fee that is incurred on the service that has been actually provided to them. So in actual sense, that we as Malawi Blood Transfusion, we do not sell blood to people, but it is only the government who recovers the service fee that that has been incurred when we're processing blood. Yes.
How do you ensure insufficient blood supply in rural and public hospitals?
Okay, so each and every, we have a very strong relationship with these hospitals, and each and every hospital has been given a specific day in a week to come and collect blood at the center. So each and every hospital knows that, let's say, for example, on a Monday we collect blood on a Monday, we collect blood on a Tuesday. So actually the blood is distributed according to the request made by a particular hospital. Yes.
What is the process of ordering and receiving blood?
Okay, so I think on that one, us as MBTS, our mandate is just to collect blood and distribute to the hospitals, not at a personal level. So when we distribute to the hospitals, the hospital also has their own, they have their own system of which a physician would actually request for blood for a particular patient. So that is decided by the doctor to who is supposed to receive blood and at what point. But for us, it's just that we collect and we store, and then we distribute to the hospitals. So whenever it's the time for a patient to receive the blood, it's the hospital that decides. But we actually don't decide because it's always the doctors who actually give out the prescription that this person is supposed to receive blood and this one is not. So us, it's just collecting and then distributing to the hospitals.
How does Malawi Blood Transfusion respond to emergency blood shortages?
Okay, whenever there's an emergency, the hospitals always contact us that they want an emergency. They have an emergency at the hospital and they want blood. So when we always have blood that is there for such type of emergencies. So whenever a hospital calls that they have an emergency, they need blood, we actually tell them to come to our lab. So our laboratory is always open 24/7. We do not close because of such type of emergency. So they do call us and we actually tell them to come and collect the type of blood that they need.
What prioritization criteria are used during emergency blood allocations?
Okay, we actually prioritize it because it's whenever it's an emergency, it's a matter of life and death. So if there's actually another request that is not an emergency, we actually have to make sure that we send over because as you have said it's an emergency. So we actually prioritize those type of cases because there are different type of patients in the hospital. There are other patients maybe who can at least, who given time, maybe a day or two, they would leave even though without being transfused in as much as they need to be transfused. But there are other patients maybe who have been involved in an accident and they have lost blood. They don't have even time. So in such type of cases, we actually do rush and prioritize those type of